Today we're going to be discussing Chapter 26, Endocrine and Nervous Systems. There are 9 glands in the endocrine system, but only 4 are included in the endocrine subsection, code 6000 through 60699 of the CPT manual. The 4 glands in the endocrine subsections are the thyroid, code 60000 through 60300, parathyroid, 60500 through 60512, the thymus, 60520 through 60522, adrenal, 60540 through 60545, and 60650. The pituitary and pineal gland codes are in the nervous system subsection of the CPT manual. The pancreas codes are in the digestive subsection, and the ovaries and the testes codes are in the female and male reproductive system subsections. The thyroid gland is composed of a right and left lobe on either side of the trachea, just below the large piece of cartilage, also known as the thyroid cartilage. 2 of the hormones secreted by the thyroid gland are T3 and T4. Parathyroid glands are 4 small oval bodies located at the dorsal aspect, meaning the back, of the thyroid gland. These glands secrete parathyroid hormone, also known as PTH. Adrenal glands, also known as suprarenal, are 2 small glands situated one on top of each kidney. There are 2 parts to each gland, the cortex, which is the outer portion, and the medulla, which is the inner portion. The cortex secretes the hormone corticosteroid, and the medulla secretes the hormones called catecholamines. The thymus gland is located behind the breastbone in front of the heart and is involved in maturation or development of the immune system. Thymectomy is the removal of the thymus and is usually performed by cutting through the breastbone, similar to heart surgery. The pancreas is an organ that is located behind the stomach, and the head of the organ is attached to the duodenum, which is the first section of the small intestine. All the organ is listed in this heading: parathyroid, thymus, adrenal gland, pancreas, and carotid body. The codes for procedures involving the pancreas are located in the digestive system subsection, codes 48000 through 48999. The endocrine subsection includes these subheadings: thyroid gland and the parathyroid, thymus, adrenal glands, and the carotid body. The other endocrine glands are found elsewhere in the CPT book. The pituitary and pineal glands are located in the nervous subsection. The pancreas in the digestive, the ovaries, testes in the respective female and male genital systems. The carotid body refers to an area adjacent to the carotid artery that can serve as a site for tumor excision. The carotid body is rich in capillaries and acts as receptors of the carotid arteries. The code for tumor excision in the carotid body is code 60600. The thyroid gland is composed of right and left lobe on either side of the trachea, just below a large piece of cartilage. 2 of the hormones secreted by the thyroid gland is T3 and T4. The thyroid gland normally produces about 80% T4 and 20% T3. These hormones are necessary to maintain the normal level of metabolism in the cells of the body. Thyroid function test, also known as TFTs, assesses the level of hormones produced by the thyroid gland. Within the thyroid gland subheading in the CPT manual, code 60000 through 60300, there are the categories of incision, excision, and removal. The code descriptions in the excision category often refer to partial or subtotal, meaning something less than total or total. The code for thyroid incision is code 60000. The central nervous system includes the brain and the spinal cord. The peripheral nervous system contains 12 pairs of cranial nerves and 31 pairs of spinal nerves. The peripheral nervous system is divided into somatic nervous system, autonomic nervous system, and the enteric nervous system. The somatic nervous system coordinates body movements and receives external stimuli and is under conscious control. The autonomic nervous system is divided into sympathetic, which responds to stress, parasympathetic, which constricts pupils, slows down heartbeat, dilates blood vessels, and stimulates digestion. An enteric division manages digestion and is under conscious control. The nervous system subsection codes 61000 through 64999 are codes to report procedures performed on the brain, spinal cord, nerves, and all associated parts. The subheadings are divided according to anatomic site, whether it is part of the brain or spinal column or a type of nerve. The subheadings are further divided by the type of procedure. The codes report services on both the central nervous system and the peripheral nervous system. To assign the correct code, the coder must first know the purpose of the procedure because many of the code descriptions indicate the condition responsible for the procedure. Examples include abscess, cyst, hematoma, foreign body, tumor, seizure, hydrocephalus, herniated disc, meningocele, or neurofibroma. In addition to the techniques used for the procedure, many of the procedures require radiological supervision and interpretation. Next, the coder must know the location of the procedure within the skull, the meninges, or brain. The meninges are the system of the membranes that enclose the brain and the spinal cord. The meninges consist of 3 layers of connective tissue. These are the dura mater, arachnoid membrane, and the pia mater. The first 2 categories of codes are injection, drainage, or aspiration, code 61000 through 61070, and twist, drill, burr holes, or Tefrin, code 61105 through 61253, that deal with conditions that may require holes or openings made into the brain to relieve pressure, insertion of monitoring devices, placement of tubing, injection of contrast material, or to drain a hemorrhage. Procedures in the craniectomy or craniotomy category are reported with code 61304 through 61576. These procedures deal with actual incision of the skull with possible removal of a portion of the skull to open the operative site to the surgeon. The skull base is the area at the base of the cranium where the lobes of the brain rest. Lesion removal at the skull base is very complex and often requires the skill of several surgeons working together. Coders should read the extensive notes provided in the CPT manual. The approach procedure code 61580 through 61598 is the method used to obtain exposure of the lesion, either anterior cranial fossa, middle, or posterior. The approach procedure is the anatomic location. The definitive procedure code 61600 through 61616 is what was done to the lesion, such as biopsy, excision, repair, or resection. If one physician did both the approach and the definitive procedures, both would be reported. Codes in the repair and or reconstruction of surgical defects of the skull base, code 61618 through 61619, are performed to rebuild the area used for entry into the skull. This type of repair is the last step of reconstruction and is reported separately only if the service was documented in the medical record as extensive. If the same physician performs both the approach procedure and definitive procedure, both would be coded. The lesser procedure, the approach, should have modifier 51. If different surgeons each performing their own portion, approach, definitive, and repair, then each surgeon would code their own portion separately. The modifier 62, 2 surgeons, or 66, surgical team, is used when appropriate. A shunt can be considered a draining device that enables fluid to flow from one area to another. A shunt is necessary when the body is not able to perform the drainage function on its own. In the case of a cerebral spinal fluid shunts, code 62180 through 62258, the fluid is produced in the ventricles of the brain but does not drain properly and may continue to accumulate in the brain, building pressure and causing brain damage. The spine and the spinal cord subheading includes code 62263, 63746, which are used to report injections, laminectomies, excisions, repairs, and shunting. When reporting spinal procedures, you must determine the condition, the approach, whether the procedure was unilateral or bilateral, and whether multiple procedures were performed. Often when laminectomy, which is removal of the lamina, is performed, and arthrodesis, which is surgical fusion of joints, is also performed. In some cases, spinal instrumentation procedures, the use of rods, wires, screws, are also performed. When multiple procedures are performed, you must review the operative report and confirm all procedures are reported. The basic distinction among the codes in these ranges is the condition, such as a herniated intervertebral disc, as well as the approach, anterior, posterior, or costovertebral. Nerves are sensing devices, and they carry stimuli to and from all parts of the body. Some common procedures performed on nerves include injection, destruction, decompression, and suture or repair, and are reported with codes from the extracranial nerves, peripheral nerves, and autonomic nervous system subheadings code 64400 through 64999. The space around the nerves can be injected with anesthetic agents to cause a temporary loss of feeling, code 64400 through 64530. The code is assigned according to the type of nerve being injected. Nerves may also be injected to cause destruction of the nerve and permanent loss of feeling in a specific area of the body. Persons with debilitating pain may undergo this type of procedure, and the diagnosis code must be supported the medical necessity of the procedure.